Hello everyone, welcome to my channel. My name is Dr. Tosin. I'm a medical doctor and a health coach, and I'd like to welcome you to my channel. Today I'll be talking about diabetes and the ketogenic diet. So the question of the day is the ketogenic diet safe for diabetics? What's inspiring this discussion is because of the recent World Diabetes Day, and for those of you that do not know, it was on the 14th of November, World Diabetes Day. Now, before we go on, if you're new to the channel and you haven't subscribed, please hit the subscribe button, which will be at the down left hand corner, and also hit the notification bell. That way you're kept up to date with my content, ranging from topics on the ketogenic diet, healthy lifestyle tips, and my vlogs of my life as a family man, father, husband, parent, and working dad, basically. Now let's go on. What we're talking about is the ketogenic diet safe in diabetes. So as just a quick rundown, what I will be focusing on, it will be type 2 diabetes. And there are two types of diabetes. There's the type 1 diabetes and the type 2 diabetes. They are completely separate things, and for the purpose of the discussion, we'll be focusing on type 2 diabetes. Type 2 diabetes is generally a state of high blood sugar, hyperglycemia, which is usually due to an insulin resistance or a relative deficiency in insulin. It almost always occurs in adulthood, although there are some people that get it in their early teens as well, and it's technically a self-inflicted illness. What that means is it's something that is dietary related. There is some genetic disposition to it, but what we are finding lately and more, it's due to the lifestyle changes people are living, the type of food they are consuming, and that's what's really leading to it. There is an obesity epidemic around the world. The term has even been coined diabesity, obviously combining diabetes and obesity, and that has led to a pandemic and a breakout of diabetes. Now, the population of people with diabetes has quadrupled in the last 10 to 15 years, with in the UK 1 in 4 people over the age of 45 being diagnosed with type 2 diabetes. So talking about sugars, a high content of sugar in in your bloodstream caused by insulin resistance or relative insulin deficiency. Now, sugar is sugar, whatever type it is, whether it's in fruit, vegetable, or pure sugars, all are still broken down to sugar, to glucose finally in the bloodstream, except for the small cases of things like fiber content, which obviously are not broken down and excreted. Now, it's really important that I say here now that what I'm talking about here is only intended for information and should not be used as an individual medical advice itself. If you do need full advice, I will always advise that you speak to your primary care physician or specialist if you're under a specialist to seek their advice. What I will be giving you is basic information out there for you to be well informed as to what to do and how to carry on your treatment if you are diabetic. Now, to answer the question, is the ketogenic diet safe in diabetics? I've done some quick research and found a couple of papers. The most recent one being a 1-year outcome study, which was non-randomized but non-randomized controlled study that looked into the effect of nutritional ketosis on the outcome of patients that were type 2 diabetic. Was quite interesting and quite good find. It was done by Dr. Sarah Hallberg, I think from Indiana, and what he did point to was that out of every number of patients she saw, there was some remarkable changes. Interestingly, one of the questions that comes up with people is their cardiovascular risk, which is a question a lot of people ask. The ketogenic diet being a very low carb, high fat diet with a moderate protein ratio is 5% carbs, 75% fats, and 20% proteins. they found out that there was a good drop of about nearly 2 to 4% in the HbA1c, and a reduction in use of medication. In fact, over 90% of type 2 diabetic patients that were already on insulin actually came off their insulin while on their program. Well, the program was a controlled, remote controlled trial where they were monitored by both a qualified medical doctor and a health coach over a period of 1 year, and had routine checks at 7 weeks, 7 months, and a year. I'll put the link to the study here. But what was pretty remarkable as part of the study was the cardiovascular risk. Obviously, a lot of people say, yes, we know that on the ketogenic diet, it will help reduce my blood sugars, but at the same time, it's going to cause a massive increase in my cholesterol and my LDLs, which will finally lead to me having a stroke or a heart attack. But this study found out that that is actually not true. Now, what they did was study 26 biomarkers of cardiovascular health, 26. And out of the 26 from the study, there was marked improvement in 22 out of the 26 biomarkers. Key things which included blood pressure, triglycerides, and HDLs were checked. Now, what they found there was something called atherogenic dyslipidemia, which seems to be a big problem in type 2 diabetics, which essentially means formation of atherosclerosis with a massive increase in triglycerides. Now, on the ketogenic diet, there was a real good drop in triglyceride content for up to 25%, and HDL went up by up to 20%, and there was no change in the LDL level. Now, it's interesting to note that no drug or medication, statin or otherwise, can achieve this outcome in 1 year. Statins are good in helping you reduce the total number of cholesterol, but they do not boost your HDL per se. So that was one of the good findings. It's interesting to also know that a lot of people had their risk of cardiovascular risk actually reduced over that period of time. One good thing is the improvement in blood pressure. They actually found, which was just a side finding as well, that over the 1 year period, people on their nutritional ketosis diet and monitoring had a drop in blood pressure around, I think, the systolic and blood pressure of about 10 millimoles per mercury, and diastolic of something similar. I can't remember the exact figure, but it will be in the links in the study that I'll put over here. So now, another of the biomarkers that was looked at was biomarkers of inflammation, and this was the C-reactive protein. It's basically a blood test that tells us how inflamed or any inflammatory process going on in the body. And participants had an overall reduction of 40% from what was taken at baseline at the beginning of the year. And these were the ones on having the nutritional ketosis on continuous monitoring. So if you were to ask the question, is the ketogenic diet safe for diabetics? I would say yes, it is, based on the findings in this new study. There are other studies out there that are linked to this that can help buttress this point. And I'll encourage you to do your own research and find out find out some more information. For diabetics looking at starting the ketogenic diet, I'd say that please seek advice from your registered physician, provided they are knowledgeable about the ketogenic diet. Of note is that in the United Kingdom, there is a UK NICE guidance on diet for diabetics, and this is actually centered along the DASH diet and the Mediterranean diet. These diets are actually all adapted from the American Diabetes Association, which takes to set the guideline, and that kind of flows around the world and everybody adapts around it, obviously putting their own individual research into it. That is put in to the Diabetes UK and NICE guidance, and that's what's taken into it. Interestingly, of note is that the American Diabetes Association this year, 2019, have included in an updated version their standards of care an acknowledgement that the low carbohydrate diet does play a role in reducing glycemia and the lipid profile. That hasn't filtered down yet to the NICE guidance in the UK for the meantime, but there is rigorous research going on around the benefits of the low carb, high fat diet. Over here, it is still preached that you should stay on a low carb, low fat diet, staying off saturated fats and other things. But new studies coming from America are pushing against that in a way. There is a group called the Nutrition Coalition that have actually done a randomized, or rather a systematic review of all related nutritional articles that the American Diabetes Association based their work on, and have come up with recommendations which the American Diabetes Association is looking into to help revamp the way we look at diet. So in summary, is the ketogenic diet good for diabetic patients? The answer is yes. There is not one diet that fits everybody. Diets are usually trimmed and tailored to your individual specific needs. So always seek the advice of your health care professional specialist or your nutritionist to take that on board. But clearly there is a lot of research there that shows that the ketogenic diet does work. One of the caveats and the problem with the ketogenic diet is the fact that a lot of people find it difficult to sustain over a period of time. With a lot of research going into it, there are hacks that are coming up that people can follow, and this is all littered over the internet. I will be doing my own video soon about how to keep up with the ketogenic diet, things like keto cycling, keto hybrid. So my advice is, if you want more, subscribe to the channel, click the notification button, and you'll be getting up-to-date content on this. And this is Dr. Tosin, and hope to catch you on another video next time. Thank you very much.